I look at diversity as differences, and those differences can be any kind of differences. It doesn't have to be racial, ethnic, or cultural. It can be differences in your educational discipline, differences in your region where you live, because each one of those things carries with it a different culture and a different perspective.
You can strengthen your organization by having that variety of people within the organization.
I know there's a lot of textbooks definition about diversity, but here within Community Health Network organization, and the mission and vision that I see is 3 simple words that we embrace. We look at awareness, we look at interaction, and we look at acceptance.
Diversity within the Community Health Network is all about welcoming our patients, welcoming our employees, welcoming our physicians.
We are an organization that recognizes the value of diversity within our organization and hope that that overflows and spills out into the community at large.
One of the ways that the whole idea of diversity and appreciating diversity is spread in the hospital and the network is once you begin to recognize some of these differences, then you want to know more about that. And that's what I've seen happen with our employees. They want to know more about some of these cultural differences and how can they, as healthcare workers, better meet the needs of their patients who are different.
We don't just look at one way of doing things. We're an organization that tries lots of different ways of doing things based on the input from our employees.
As far as a bigger plan in our community, one of the things that we look at is the social determinants of health. And there are many things that do impact health. Access to health care certainly is one of those, but access to quality education, opportunities for economic development, housing, safe and a secure neighborhood. Those all put together create a healthy community.
As we branch out from that and do particular projects, I've certainly been very proud of Project Search.
Project Search Indiana is a high school transition program for significant disabled high school students, and we house this classroom here at Community East, and we set up different job rotations, so it's almost an on-the-job training opportunity for these high school students.
We just think that, that giving folks a chance to succeed and helping them with some of the abilities that we've picked up is a good way to sort of transfer knowledge to others.
Habitat for Humanity and some of the things we do out in the community to really try to address some of their needs, not just their medical needs, but their socioeconomic needs, their cultural needs, and to get them involved in what we're doing at the hospital.
Well, I had a Habitat for Humanity house built. Community was one of my biggest sponsors. At the time, I was working at another hospital, and I wasn't getting the hours I was supposed to get. Well, I ran into, I believe it was Dan, I ran into him the day of my panel bill, where we built my walls, basically. And he asked me about where I worked at. Well, I told him where. And I think that day I had got off that morning because I was working night shift. And he was like, well, have you ever tried community? That has touched my heart greatly. I'm always being thankful. Like once I got the job, I make sure I emailed Dan along with the president of the company, because she was another one who came out and helped build on my house and was very into helping me get this job here.
It's not that just we're doing Habitat or we're doing Project Health or we're doing Project Hope or whatever project we do. We really do it with a holistic idea in mind, and how the assets and strengths of any individual or the members of the community itself contribute to making it a better place.
The reason that the Community Health Network has been so strong is we've relied on the ideas of a whole range of people and their thoughts and some of their values, and we've put them together into an organization where people value many of the same things, but they bring different strengths and different ideas to the group.
It will be an ongoing effort to continue to improve and to continue to build on the foundation that we've established.
We will celebrate our victories, but the work will never be done. We can always get better.